The Health Resources and Services Administration has awarded $1.6 million in federal grant money to the Pioneer Valley to help train community health workers in addiction and substance abuse disorders. Holyoke Community College is the lead partner in the project, which will train students in classes and in the field at on-site community health centers in Springfield, Holyoke, and in Franklin County. Carloee McGrath sat down with those involved to learn more.
Holyoke Community College was awarded a 2-year supplemental fund to basically train community health workers. That was in addition to our original award, which Areliz is part of. And what that award does is it trains community health workers, we call them, CHWs, in a paraprofessional role. It's 3 classes, so they actually take 3 classes for college credit. They take the core competencies class, which is directly in line with what's happening at the state level for certifying CHWs. Then they take an addiction-focused class, and then the 3rd class is a practicum. So for the practicum, we actually have 3 health center partners: Community Health Center, Franklin County, Holyoke Health Center, and then the Springfield Health Department, their health services for the homeless. And so we will place students in one of those 3 sites for the fall semester, and they'll do actually a 125-hour practicum. So that's basically the course sequence.
So the big focus, of course, is the opioid component of this training. Can you explain a little bit about what a community health worker does?
Sure. So community health workers, I'm going to let Areliz jump in a second here, but community health workers, it's not a new field, it's not a new role. These folks have been working internationally, in sub-Saharan Africa, in the United States for, years and years and years, really being the bridge between individuals and families and individual cultures and belief systems and practices and healthcare systems. So that is kind of what we're looking to do, is to provide a workforce of folks that can connect, that have a unique lived experience, either through something like, coming from Puerto Rico themselves and having relocated to Holyoke, or someone who has a lived experience with recovery and substance use and therefore can go and work in that community, or even someone that has a history of incarceration and so can come and then work with folks transitioning out of incarceration with addiction in other areas. So the role is really kind of an intermediary link between individuals and systems.
Okay, and just explain to us a little bit about your background and what drew you to this career path.
So I am very fond of the addiction field. My mother is in long-term recovery, 18 years, and so I am a big advocate with substance abuse and mental health. So that's what drew me. And when it was presented, I was like, 10 free college credits, how can I not take advantage of it? I'm also full-time at Springfield College, and the program there allows me to transfer credits in. So I'm actually graduating a whole semester ahead of time because of this program with HCC.
And you also have a full-time job on top of that.
Yes.
Okay. And explain the importance of having somebody like you with that. You do have lived experience talking to another family who's struggling with somebody in the house who is addicted to opioids. How important is that connection with people?
I think right now it's the number 1 connection. People want to know, they want to hear that there's hope. They don't want to be looked down upon. They want to know that it is attainable. Recovery is attainable. Recovery is different for each individual, and it should be treated per each individual. I think something in the past has been recovery is one for all, and how I could help with my life experience is advocating and seeing an individual where they're at, but seeing them at their best. Meeting them where they're at, but seeing them at their best. With recovery and substance abuse, there's a lot of stigma, and I am a big advocate. Becky could attest to that. Because I've lived it, I know the treatment, the looks, and so I'm able to connect my members to providers and help them seek treatment, not only in recovery, but also with their medical health also.
Okay, so Ed, up in Franklin County, how helpful will this be to be part of this grant?
It's going to be tremendously helpful. We have used community health workers for a long time at the health center. I think what's fantastic about this program is the special emphasis on opioid and substance use treatment. I think that we've used community health workers, as Becky was saying, for a long time around supporting a patient's execution of their treatment plan from their primary care provider. And I think having someone with lived experience, someone who's part of the community, really helps in sort of translating the message from the physicians and the nurse practitioners to the patient. So I think it's going to be a really powerful component to what we're doing.
And tell us a little bit about what you have seen from your standpoint in Franklin County when you're talking about the numbers and the devastation of families of the opioid crisis. I know it's everywhere, but
it's everywhere.
You're right in it.
Yeah, it is. The degree of opioid abuse in Franklin County is really tremendous, and I think part of it is compounded by the rurality of the towns. I think some of the social isolation is an additional factor in Franklin County. I think fortunately, there are a lot of resources in Franklin County though to help folks. There's the Franklin County Opioid Task Force, which is amazing. And all of our primary care providers are able to prescribe medication-assisted treatment, Suboxone and so forth, to help people overcome this terrible addiction.
Okay, and now
Yeah.
Holyoke and Springfield will also be part of the grant as well. You'll be working with them as well?
Correct. So HCC got an original award to actually provide the training for community health workers. So for students coming into this, it's free tuition, fees, any books, everything we cover, and then they walk away with 10 college credits. The health centers get a separate award that's $200,000 a year.
That's right.
For each year. So $400,000 total for each health center. So it's a significant contribution for both HCC to be able to provide this training, and then the health centers being able to provide not only our students but other staff as well.
Yeah, that's true. And just to expand on that a little bit, I think that healthcare these days has really gone beyond simply getting a flu shot and having your sore throat looked at. I think primary care providers these days are much more cognizant of the social factors that people come in with. Whether they're food insecure or whether they've got housing issues and so forth. And I think that having support staff like community health workers is really critical to improving health outcomes for people.
Okay, and last question for you. I just wanted to know, what would you say to families who are struggling right now with an opioid addiction?
To the family members, I would say for a recovery to be attainable and for a person to be successful in their recovery, they need a strong support system.